afternoon, and welcome to our monthly Health Products for You Sleep Well webinar, where we dive into all topics sleep and respiratory. We're glad that you could join us, whether you're joining the live webinar or you're joining us in a replay on our YouTube channel. We're glad that you're with us. We provide this as a value-based service to our customers, just as a service and a value that is needed in today's market, where there's questions with regard to respiratory issues. We have our certified respiratory therapist with us as always, Laura Castricone. Laura, welcome again.
Thank you, Justin. Hi, everybody. Hope you're having a good afternoon.
Yeah, we're hoping everybody is doing well. So Laura, today your topic that was chosen was about peak flow meter. So let's jump right into it. What is a peak flow meter, and how would we benefit from using one?
So what a peak flow meter is a very small device, and we use it as a tool to measure how much airflow someone can blow out in the first few seconds. And what we suggest people that should use it should be people that maybe have asthma, emphysema, or any form of COPD, chronic bronchitis. And it allows the person to self-monitor whether or not their flows are stable. Are they going up? Are they getting better? Are they doing well? Or are those flows decreasing? And that's basically, it's a tool, and it's a very inexpensive tool, and it doesn't require a prescription, which is a great thing. So I thought this would be a nice adjunct to our last webinar, which was about nebulizer treatments, and for people that have asthma or chronic bronchitis or COPD, because this is another tool to add to your, as I call, your healthcare toolbox. So that way you can be, you can do some self-monitoring to see if maybe you can stave off something.
Very good. Okay, so how do we actually use the peak flow meter?
Yeah. Yeah, here we are.
So how do we use the peak flow meter, Laura?
So a peak flow meter, when you buy them, they'll come with a they're small gauge with a pin inside, and they'll come with a chart that will let you know, based on your age, your gender, and your height, what your peak flow should be. And a lot of times your doctor will give you what he thinks the proper range might be if he knows you're using a peak flow meter. And what you would do is every day, at least twice, sometimes 3 times a day, or as often as you want to, you'll do a hard, forceful blow into the peak flow meter, and the little needle will go up to a number, and you'll record that. We suggest when you do it 3 times in a row, and try to do it with the same amount of force so you can get reproducibility, and then take the average of those, of whatever the average of those 3 are. And it allows you to do that. If you do it in the morning when you first wake up, it's not that bad to do it after lunchtime and one time in the afternoon. And we also tell people to do it before and after their breathing treatment, so they can see the benefit of their nebulizer treatment, whether or not that drug is working for them.
Okay, all right, very good. And then as we're using this as an adjunct to our nebulization and nebulizer treatments, what do the findings on the meter indicate?
So usually an adult will have a reading of 400 to 600 liters per minute. And you don't really have to know what that means. It'll be on the chart, and it'll show you on the meter, there'll be a green zone, a red zone, and a yellow zone for your goal. And if you don't keep going in the green zone, that means, if you're in the yellow zone, that means something is happening. That means your airway is probably narrowing. Is it increased inflammation? Are you getting congested? Are there pollens that are causing something to make your airway constricted? What's going on? And if you notice that those numbers, as you're recording them, are going down, 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 you may not feel that bad, but something is brewing. That's what we used to tell people. It's time to get your physician or your healthcare provider in the loop, and tell them that I've been measuring my peak flows and starting to go down despite my use of my nebulizer treatments. You should find with your breathing treatments that before and after should be markedly different. With some people with COPD, it's as good as it's going to get, but the peak flows will allow you to, like I said, know something is coming, because it shows that the airway is narrow. You can't fake that. When you blow out, if you just, no matter how hard you try, you just can't push the air out because the airway is too narrowed.
Laura, You don't happen to have a peak flow meter to demonstrate that, do you?
I wish I did.
Okay.
Now, I should have grabbed one from work, but it's tubular shaped, or some of them are flat, and you'll put it up to your mouth. You take a deep breath in, blast the air out real quick, and the needle will jump up to the number at that first blast. And then you'll write that number down and record it. And then you'll do that again 2 more times. And you'll see they should be right in the same range. And you'll take the average of those 3, or the best of those 3, and use that as your marker. So if later in the day you do it again and it shows that the numbers are lower, sometimes people could tell, but some people can't tell when something is coming. They don't realize the caliber of the airway is actually decreased, and they don't even feel it. They may have their normal cough or, phlegm production, but the peak flow meter is a very inexpensive tool. Usually they range anywhere from $20 to $30. I think we have 3 of them on our website that I saw that I think are under $30. So, but they're a great tool to have. No prescription required. You can usually find them in any pharmacy. I think even Walmart probably carries them in their pharmaceutical department. And it's a great tool. And they have 2 different types, one for adults and one for children. So there's a low flow peak flow meter for children, and a high flow for adults. Because kids, obviously, their ranges are going to be vastly different than ours. But if you have a child that has reactive airway disease or is taking breathing treatments for asthma or anything else, it's a great tool. We use them a lot, and we used to use them a lot in the hospital, especially in the rehab facilities, just to know if somebody's flows were starting to decrease, even though they couldn't physically feel it.
Well, very good. Nice topic for us, Laura, that just continues to add to the resources that are available on getting questions answered. As always, if you're here live with us or you're watching on replay on our YouTube channel, please don't hesitate to reach out to Laura. Her email is Laura, Laura, at hpfy.com, Laura at hpfy.com. She's available to assist with anything. Go ahead, Laura.
One comment I do want to make is that a peak flow meter is not meant to diagnose asthma. So if you have not been diagnosed, don't think you're going to use this to diagnose that disease. It's used as a tool when you already know that you have it, to hopefully keep you out of the emergency room. That's the goal of it, is to watch your peak flow so that way you can get your doc involved, maybe get on some steroids or whatever his suggestion is before you have to go into the hospital for an emergency.
Okay. So again, it's a continuum of care. It's a part of the whole care process, and yep. Again, a very inexpensive tool. Every home. Would you recommend what?
I would say everyone that has a child, especially nowadays, because between COVID and there's a big surge in respiratory syncytial virus, which we call RSV. Lots of kids are getting it. The younger the child, the usually more affected their lungs will be. They may have to be hospitalized. But if you teach a child how to use a peak flow meter, and they have a reactive airway disease, or maybe have very bad allergies, it'll help you to understand what's going on without actually being able to see inside there. I don't know if every household needs to have them, but certainly anybody that has a child or a household member that has asthma or any kind of reactive airway disease should have one.
That's helpful guidance if we don't have one in our home. Really inexpensive to HPFY.
It's a great tool. A lot of people forget about it, and a lot of docs forget to even suggest them. I think it's a great tool for asthmatics.
Great. So again, if anyone watching this, readily available on HPFY in our respiratory category or on Shop Nebulizer as well. Laura, thank you. We appreciate it. Doesn't look like we have too many questions today. We do have our open Q&A session. If anyone has any questions, we are welcome to any question relative to peak flow.
Doesn't have to be just peak flow, yeah.
Yeah, it could be anything. Well, Laura, it looks like you answered it today. So we'll go ahead and wrap up for today. We look forward to next month and another excellent webinar set up for us. Again, please don't hesitate to reach out to us. Again, that's Laura at HPFY. And you can also, by way of that, recommend topics. We're always looking to understand exactly what our customers are experiencing, what they would like to hear, and have Laura address in the webinar. We're more than welcome for those suggestions, so please don't hesitate. And again, we look forward to seeing you again next month. Thanks, Laura.
Thank you.